If you or someone close to you is one of the 13 million people in the US suffering from carpal tunnel syndrome, you are all too familiar with the debilitating impact it can have on your livelihood and quality of life. Carpal tunnel syndrome is a condition that develops when a major nerve in the hand, the median nerve, gets squeezed as it travels through the carpal tunnel in the wrist. The symptoms are unmistakable: a tingling sensation of pins and needles in your hand, numbness, sharp pains, and reduced strength. Together, these symptoms can make everyday tasks nearly impossible and will often keep you from getting a good night's sleep. Treating carpal tunnel syndrome typically involves one of three options. Option 1 is self-management. This means managing mild symptoms by doing things such as taking frequent breaks, performing hand exercises and stretches, or wearing a wrist splint. Keep in mind that these options may only provide temporary relief and may not address the underlying issue. Option 2 is medical management. This involves getting steroid injections to reduce inflammation and pain. These injections typically provide short-term temporary relief and can become less effective over time. Option 3 is surgical intervention. This is a procedure called carpal tunnel release, and it can bring long-lasting symptom relief. Carpal tunnel release involves making an opening in a ligament in the hand. This creates more space for the nerve and tendons, relieving pressure on the median nerve. Traditionally, these procedures have been done via open surgery or endoscopic surgery, which are typically performed in an operating room under general or regional anesthesia. You may be worried about surgical pain and how surgery could impact your life as you recover. Traditional procedures often have recovery times that can take weeks or months, and patients are typically prescribed opioid painkillers to manage their pain after surgery. In some cases, patients may also require post-operative physical therapy. Given this, it is no wonder why millions of people put off having surgery until their symptoms become unbearable. Unfortunately, avoiding or delaying surgery can result in permanent damage to the nerve. If you wait too long, surgery may not be able to make your symptoms go away. It can only keep them from getting worse. But now there's a safe and proven technique to get rapid relief from carpal tunnel pain and return quickly to normal activities. Using a device called USCTR together with real-time ultrasound guidance, your doctor can perform carpal tunnel release in a matter of minutes in their office or a procedure room. This technique involves one small wrist incision. Then, using ultrasound guidance, the device is inserted and the ligament is released to provide more space for the nerve and tendons. The incision is typically closed with just a bandage, no stitches. You don't need to be unconscious during the procedure, and most patients only require Tylenol or ibuprofen to manage any post-operative pain. Once you have the procedure, no further physical therapy is usually needed. Best of all, recovery is quick. Most patients can return to work and the activities they love within 3 to 6 days. Your doctor will let you know what to expect on the day of your procedure. Your visit to the clinic should take less than 2 hours. After your procedure, the doctor will provide you with some care instructions, including what activities are recommended in the first few days post-procedure, specific to your condition. It's really that easy. So, if you're considering carpal tunnel release, ask yourself, how valuable is your time? What would it mean to be able to get back to doing the things you love as quickly as possible? If you're ready to get out of pain and back to life, ask your doctor about carpal tunnel release with real-time ultrasound guidance, because quickly getting back to the things you want and need to do can be priceless. Recovery in days, not weeks.